here with Dr. Joseph Fretta, who specializes in vein treatment, cosmetic surgery, and body contouring. Good morning, Dr. Fretta.
Good morning.
Thank you for having us.
It's a pleasure.
Could you explain a little in detail about the services and procedures that you offer?
Here at New Jersey Vein Cosmetic Surgery Center, we offer all the treatments for varicose veins, spider veins and blue reticular veins, those bulging blue veins that aren't really varicose veins. Those treatments entail something called endolaser ablation of varicose veins, where through a pinprick below the knee or in the mid-thigh, we can thread a catheter in the leg, in the vein of the leg, the varicose vein in question, and turn on the laser. This is a laser catheter, and as we pull this laser catheter out, we're cauterizing the vein and closing it down. So this is completely ambulatory, no general anesthesia is required, and the patient can return home driving on their own right after the procedure. Another treatment for spider veins is sclerotherapy. That's using hair-fine needles to inject away the little spider veins. Again, it's essentially a painless procedure. Feels like little mosquito bites, not a bee sting. And we can eradicate all the veins that way. Another procedure that we do is called ultrasound-guided sclerotherapy, when they have larger veins, but they're not varicose veins and they're deeper in the leg. Using an ultrasound machine, we can visualize the veins deeper underneath the skin, underneath the TV monitor, and guide needles to those areas and inject those veins away. So in doing so, we reduce the heaviness and swelling that people have from venous insufficiency or varicose veins, and improve the appearance of the leg simultaneously. As a nice aside to those treatments, my patients told me, gee doc, not only did you get rid of all my little spider veins and blue veins, but my legs are slimmer now.
Really?
Yeah. So it dawned on me, this is years ago, that one of the causes of the cottage cheese that people get, that they call cellulite, if they're not addicted to Dunkin' Donuts and eating wrong, but the people who exercise right and do everything right but still get the lumpy bumpies, is the fact that they have these nests of venous insufficiency in their legs. And using loupes that illuminate the skin so we can see the underlying vein, you can see the veins underneath the skin that engorge with extra fluid, a backwash of blood, and the water component in those veins seep through the walls of the veins, and that water is absorbed by the fat cells, and that's what gives everybody that lumpy effect.
Interesting. I never heard that. Treatments do you offer?
One of my favorites is this new technique that's been out for about 2 years called Smart Lipo. That and another machine called Shazer Lipo, when used in conjunction, blow away the old liposuction and tummy tuck. Number one, it's ambulatory. You can have your treatment. These treatments take about 4.5 hours, but you're rested. We take care of you, reshape your body, whether it's underarms, abdomen, hips, thighs, and after the treatment is done, you're wrapped and you're free to leave. You can drive home on your own. And because we're using these different catheter probes that we're inserting through a tiny little nick underneath the skin to melt away fat and tighten skin simultaneously, there is minimal bruising, because the heat of the catheter, whether it's the laser catheter of a Smart Lipo or the ultrasound catheter of a Vaser Lipo, they generate heat and cauterize the blood vessels as they're melting away the fat and tightening the skin. So in the hands of someone who has a good concept of contouring people, you can really reshape people and give them back a nice silhouette. And it's great. I mean, I've had women who had 4 children that I've been able to recontour again, and they can wear a 2-piece bathing suit again and not have the scar of a tummy tuck.
And the effects are permanent?
And the effects are permanent.
That's fantastic. And what about cost? Is it comparable
cost, to... It's a lot less money than a liposuction and tummy tuck. Those costs usually run into the $12,500 range. These procedures run in the $4,000 to $5,500 range. And the nice thing is, the next day you're ambulating, you can go to the gym and walk a treadmill. You're not out of action for 2 months where you would be with major surgery. And you can return to work the next day, household chores and everything.
I
Swelling.
understand that you offer various fillers and facial procedures. Can you explain what those are?
You know, everybody in America likes to get Botox these days. And I like Botox. It's easy. I'm adept at anything using a needle because I can inject the tiniest little spider veins, even veins around the face. So injecting Botox is just an extension of my practice. The other thing that we do is we inject a lot of the fillers. I like embellishing lips, but I don't want to make anybody look like some of our famous or infamous starlets.
Who shall remain
Huge lips.
nameless.
I like to give people a nice, natural look, just a little bit of embellishment. And in using fillers, my favorite fillers are Radiesse, which is a thicker filler, Restylane, which I use on lips, and Juvederm Ultra Plus, which I also use on lips. You know, we'll inject the nasolabials, a little lip embellishment, number 11 lines. And I like using fillers, injecting along here from this area toward here, and then pulling the needle back as I'm injecting to plump up the cheekbone area. Because as some people age, they get plump and pouty looking, and other people get drawn and gaunt.
Right.
So fillers do come into play. Now, when you're in your late 30s or early 40s and you need just a little tweak, that's where Botox and fillers really come into play. If you are older and have more rigors of age, that's when these other procedures like smart lipo on the face comes into play. First tighten the skin, then see if you have to do something else to embellish to give a more youthful look.
Now, as far as the fillers go, how long do the effects last?
Different fillers last different time periods. I mean, you can use a lot of fillers that are, quote, permanent, but permanent really is about 5 to 10 years. Those fillers are nice, but I don't know how the rest of your face is going to go 5 or 10 years from now. So I'd really like to use something that has a year-long effect. And Radiesse lasts about a year. If people are really, you know, educated in what they want, and you know, then I'll use a longer acting filler. Otherwise, I always suggest use something that won't last longer than a year. This way, if you're not happy with the look, it's not permanent.
Exactly. And what about cost?
Cost, we don't charge as much as a lot of other people charge on the fillers. I charge $685 for the Radiesse, and you know, other people charge as much as $880 for a syringe of Radiesse, and I charge $575 for the Restylane, and about the same for the Juvederm.
Wow, very
So
reasonable.
I try to keep it reasonable because I know these aren't permanent things, and you know, keep it reasonable, keep people looking good, and they'll come back for more treatments.
Absolutely.
I like to build relationships with my patients.
This animation shows how varicose veins form. Varicose veins are swollen veins that are a blue or purple color. They show through the skin, usually on the legs and feet. Click the navigation arrows below the animation screen to play, pause, rewind or fast forward the animation. The superficial veins lie below the surface of the skin. The deep veins pass through the deep tissues of the legs. They transport blood from the legs and feet back up towards the heart. The superficial and deep veins are connected by perforator veins. Here we show the position of the deep veins, superficial veins, and perforator veins in the leg. The deep veins run between the muscles of the legs. Contractions of these muscles, when you move your legs and ankles, help to squeeze the blood back up towards your heart. Veins also have valves that prevent the blood from flowing back towards your feet. Here we show a valve and the muscles around the vein. Varicose veins are thought to develop when the valves don't close properly. Here we show a valve in a superficial leg vein. If the valves don't work properly, the blood is able to flow backwards. Blood pools in the vein, causing the vein to stretch. This is called a varicose vein. Here we show a vein that has become varicose. Here we show a varicose vein in the lower leg. Varicose veins may cause symptoms such as aching, itchiness, or swelling of the ankles. However, often they don't cause any symptoms. The main problem is usually their appearance. This is the end of the animation. Click on the animation screen to watch it again.
Okay, here with my patient that we're going to do a procedure called endolaser ablation of varicose veins. I'm just mapping her before we do the actual procedure. This varicose vein here comes from a broken valve within here. And that little windy sound is blood flowing the wrong way, filling this vein. Sounds a little bit higher in volume here because there's a crescendo effect as the blood continues to drop down. So through a pinprick incision here, I'm going to insert a catheter up to do a vein track underlying this one and stop this leak, and that'll diminish the flow of blood here, and this vein will disappear. Sounds great. All right, that dark tunnel you see on the screen that's going across lengthwise, that's the vein in question. And we're going to thread a catheter into that vein. That's the vein that's feeding the bulging vein on my patient's surface of her leg. Now, I'm just numbing this area. Now it's numb, and now I'm inserting a needle to the vein. Okay, now I'm in. You can see that little needle there. And now I'm putting this guide wire in the vein. Okay, I'm going to pull a needle out. Now we're making a tiny little incision. This was a tiny little blade for the incision. You see my wire there. Okay. Now I'm taking the needle out. Putting the catheter in. Okay. Guide wire comes out. And this is the actual laser fiber going in now. All right, this is one of the just another. There's this plastic catheter that the laser catheter is in, and that's all in her vein. The vein itself with all these catheters are in a tunnel of the body's own connective tissue. Now we're going to flood that tunnel with fluid to numb the area, collapse the rest of onto the laser catheter, and protect her skin from the heat of the laser. And this also numbs her at the same time. On a scale of 1 to 10, how uncomfortable is this for you? 1. That's what I like to hear. That bright, straight line is the catheter. This is my needle injecting fluid coming from the right corner of the screen to envelop the vein and the sheet that the vein is in with fluid. We enveloped the whole thing with fluid and kept this thing away from the surface of the skin. Okay, now we're going to fire the laser. Just let's tilt our table a little bit.
You're going to smell it.
Okay, here we go.
Cindy, to 10 centimeters of vein treated.
Actually, probably 11.
200, thank you.
And that was the laser catheter.
How would
This is the tip of the laser fiber.
Okay, turn on my pump.
This is the end of the catheter. Very nice. This is the fascial sheath peeling away from the catheter in the vein.
Here we go.
How are we doing, Gene?
This is endovenous laser ablation of the greater saphenous vein. That's the large varicose vein that can occur in people generating from the groin all the way down to the bottom of the leg. A laser catheter is being inserted in the leg via a port that has been inserted first under local anesthetic. This is a totally painless situation. We are watching the catheter being threaded up the leg under ultrasound guidance, and now the guide wire of the catheter will be removed once certain measurements are taken. This is it being removed now, and the laser fiber will be inserted in. The fiber is a capellini sized strand of fiber optic spaghetti that's actually being inserted through this catheter, which we are watching being located in the precise location necessary to start the lasering of the vein. There you can see the little catheter thread being inserted, and we watch it under ultrasound guidance, as I said before, to make sure it's in the proper location. Once it's set, and there we're looking at that fiber, it's a little dot in the center of the screen, looking at it head on instead of longitudinally or long ways. And now it's in the right position. The laser is being fired as the entire catheter is being withdrawn. So as we're pulling this catheter out, we're firing the laser inside the vein and gradually searing the entire vein shut. And that's the laser tip when everything has been removed. The vein is closed, the patient is awake, there is minimal bruising, and it's a very comfortable procedure.
This is the sound of blood traveling the wrong way down a vein. And that's why these veins down here are engorged. Now we have to remove the superficial branch. This process is called ambulatory phlebectomy. The incisions will be pinprick incisions. There isn't any sewing involved, and you're not going to see any scarring. Here I'm transilluminating the skin so you can see the vein underneath here, which is her varicose vein, and this is what we're going to remove. As you can see, I'm mapping out the vein that I can see with the loop. Next, we're going to have the patient lay on the table, and I'm going to inject medication to numb these areas, and then we'll begin removing the vein itself. Right now, I'm numbing the skin that overlies the veins that I have to remove. I'm sticking the needle in areas that I've already numbed, so you don't feel the pinprick of the needle. And once you're underneath the skin, there are no nerve endings there, so you don't feel any of this. All you feel is the fluid entering. We're putting betadine on to keep everything nice and antiseptic. But because we're really not cutting anything open and exposing the inside of the body to the outside elements, this is a very risk-free procedure as far as infection goes. All the equipment is sterile. The skin has been cleaned. Here's the scalpel, a tiny little blade. We're going to make a series of pinpricks along here and finesse the vein out with a tiny micro crochet hook like this. And that's the vein. Now the reason why it's white is because it's devoid of blood. We cut it down the flow from the top down, and with her lying down, she's not getting blood flow from the inner leg to the surface. Did you feel that?
No.
Okay, and that's how the whole thing is going to be from now on. And this is what vein looks like. Wherever she zigs, we zig. Where she zigs, we zig. We get the entire vein out. And she'll be able to work tomorrow. So as you can see, it's just a step-by-step procedure. And we'll show you something later. You can see how we showed a segment of veins here. This is the last section of vein to be pulled out, the back of the leg. How bad a procedure was this pain-wise for you?
Not bad.
Okay, that's good. And the beauty of it is it's a scarless procedure, no OR fees, and no general anesthesia. So you're not incapacitated in any way, even the night after the procedure. Most of my patients drive home from wherever they come to me right after the operation. Okay, that's it. This procedure is called ultrasound-guided sclerotherapy. So I need the ultrasound machine and my talented technician here to visualize my targets so I can find these veins with my ever so skillful hands. You see the middle of the screen, the arrow is pointing to, if you can see that clearly, is the tail end of a varicose vein inside the leg. And I'm placing a needle and trying to get into that vein right now. And it should do it. gently injecting the medication into that vein to close this last portion of varicose veins. My patient's leg was swollen with a lot of flaky skin from a tract of varicose veins that you couldn't see outside the leg, but it was causing a lot of problems with the surface of her skin by constantly expanding the leg. Now that we've closed the leg down, the swelling's gone away, and she's got a nicely shaped leg again and nice soft skin again, but it's been a tough year for her. I want her to have a nice summer coming down. That cloud you see in the center of the screen, that's the medication we just injected. I want to make sure it goes down the whole length of that vein. So you see that little white center in the black circle as we go up. That's the medication doing its job. This procedure was done in lieu of inserting a laser catheter in there or a stripper to pull out. It's a nice, easy, minimally invasive way of closing down varicose veins. When the vein is small enough and in the right location, it's a great treatment. And it's completely ambulatory. She'll go home with an ace bandage. She'll wear it overnight tonight, put on her support, take this off tomorrow, put on her support stocking, and enjoy a beautiful day off. And if she had to work tomorrow, she'd be free to do that too. Okay, Tracy. Okay, what you see are these little spider veins here across the top of your thigh, but what's causing these, shut off the light, are these veins that I can see with this loop here, see? Mm-hmm. All of this.
Okay.
And it's emanating from the top of the knee. There's a vein that comes out of the knee and then sprouts this underlying hose system which finally surfaces like sprinkler heads on a lawn.
Okay.
So we're going to inject this away today.
Okay.
Okay, and massage it through, and most of what I inject here should close this down, and what doesn't, next week we'll finish off with a few injections there. And that's it.
Okay.
All right. As I mentioned, we're going to inject the underlying veins with medication to close them down. This is called sclerotherapy. And I'm using this fiber optic loop to illuminate the skin so I can see the vein deeper inside that wouldn't be visible just looking at it visually with room light. Now we're going to begin the procedure. I'm flooding the whole area, the whole venous tract with medication. Come up further. Let's see where we are here. Now I'm in, and now I fire again.
You okay?
I'm swell.
Every time I put that needle in and draw back, as long as I'm getting blood in the tubing, I know I'm in the vein. I don't want to be in the skin. That forward. I'm just going to look around and see if we have any other branches as we ascend in our injections. Take this one. Now that we've injected the underlying veins, we'll address the superficial veins that the patient came here to treat. It's just a tiny bit of medication in each injection. How uncomfortable is this?
Not at all.
But when you address these superficial veins, you always have to inject away the underlying issue first, otherwise the veins are doomed to return. Now, when I examine my patient before doing make sure they don't have a deeper problem. That's where other procedures like endovenous laser, ablation of the vein, or ambulatory phlebectomy come into play, and you'll be seeing those procedures too. Again, it's just a very delicate, light injection of medication into those veins. You can't get into the skin. If you inject into the skin, you'll ulcerate the skin. the lining of the vein is strong enough to withstand the corrosive action of the medication. Now you'll note redness or erythema where we injected before. That'll go away in a couple of hours. What we're doing when we inject is inducing an inflammatory response inside the vein. By inflaming the walls of the vein, we cause the veins to constrict and then consolidate. So what was once a tube becomes a ribbon that blood can't flow through anymore. As an aside, those underlying veins in the thighs are usually the cause of cellulite in women. So by getting rid of the underlying veins that we injected before with the loop and touching up with this, my patients told me over the years, not only did you get rid of my veins, but my thighs are much smoother. I don't have the lumpy, bumpy cottage cheese anymore. So in treating those underlying veins and the spider veins, you get a 2-for-1 benefit. You get rid of the visible veins and you get rid of the underlying cause of cellulite, so you get a smoother thigh. Everybody always asks, what about laser for treatment of spider veins?
I had the laser, and I thought the laser
That's
was
painful.
more uncomfortable because you feel that snapping. It was.
Yeah, that's like snap each time it hits the skin. But within 3 weeks from these injections, all these veins are gone. So it's a cheaper procedure, it's less painful, and it's faster. It's effective 99% of the time, whereas laser is only effective about 40% of the time. Because with a laser you can't get the underlying veins. Laser is great as a resurfacing tool, to smooth out skin. But for the most part, I'd rather do inexpensive chemical peels on people to rejuvenate their skin. Nice thing about doing sclerotherapy, from an injection here, I can spread medication far beyond. Whereas with a laser, you have to hit the vein step by step by step. I just want to make this really perfect for her. This was really a quick one office visit deal. We'll see her in a week, make sure she doesn't have any congealed blood in the veins, and if she does, numb the skin, pinprick, squeeze out the blood, and send her home with a little band-aid on that. But she'll be ready for shorts in 2 weeks. Perfect, right?
I came to Dr. Fretta because I had a varicose vein that was sticking out on the left side of my leg, and it was causing me a lot of pain when I sat, or I'm on my feet all day and it would burn or itch. So I came here to have him take it out. I would highly recommend Dr. Fretta. In fact, I have a list of friends who want to see my leg when we're done for referrals to get their own legs fixed. He comes highly recommended.
I'm coming here 11 years since I had my last child, since 1998, and I started with vein treatment, and I've been coming since, and I find him an amazing doctor, great bedside manner, calls you at home, funny character. No, he's really a great doctor. And on top of that, I take his vitamins, which I have recommended to my friends, and he's out of the ordinary doctor. He doesn't do what regular conventional doctor does. He goes above and beyond, and I'm very pleased with him. So I'm still coming here, and I'm very happy with him.
I came to Dr. Fretta about 5 years ago when I was having problems with my legs. I had previously gone to a doctor in New York who ligated them, and they really didn't come out well at all. And I showed them to Dr. Fretta, and we started with injections, and I'll tell you, they really, really came out wonderfully.
I guess it's going now.
Okay, this area had laser lipo done just about a half hour ago, and this is the inside of the knee too, and this is the area we're working on now. And it's very simple. The catheter is inserted, and the laser is fired as I pull back. This melts the fat and cauterizes the blood vessels and tightens the skin at the same time. Now, I've already done several sweeps that way, and now I'm going to go in and withdraw some of the fat. And as opposed to regular liposuction, I'm not going in with a big thick wand. This is really going in through a needle prick. It'll take one stitch to close this, and we're not really traumatizing. I just want to get the melted fat out, and you can see it coming in here. And then I'll be going back repeatedly with the laser to tighten the skin further. So what comes out looks more like a chicken stock than globs of fat, because it's already been pre-melted. The patient is awake for this. This has been numbed, so it's not really a painful ordeal. And I'm just smoothing out as I'm doing this with my hand. And then I'll go back in again and tighten the area up further with the laser probe. At the same time, it cauterizes the blood vessels, so this is the maximum bruising she'll have. And this will go away in about a week as the skin continues to tighten from the treatment administered today.
That's it?
You can see the amount I've taken out so far. I'll take out about 5 or 6 of these from this thigh before I go in and tighten it again. And it's all done from one prick site, so there's no scarring. The patient will go home with a compression corset from the knee to the tummy, and tomorrow she can go walk on a treadmill. Okay.
Okay, we're on.
So is it what you expected?
No, it's hardly any. I hardly feel anything.
I pay her.
Don't make me laugh though.
Well, that way we'll see how tight the belly gets. If it's not jiggling, we're tight enough. Okay, the only thing I go on Facebook for is to look at cars and stuff like that. And, YouTube, I do YouTube. I love this new Cadillac that may be coming out in the future called the El Mirage. It reminds me of the old Caddies of my time, of the Eldorados. Beautiful, beautiful car. And today driving up here, I saw the first new. Now we just suctioned more fat out, melted fat, and now I'm back again, tightening the skin so it'll be nice and smooth when she heals. So far, how's the ride been?
Fine, no problems at all.
Alright, just noisy with that machine. But the beauty of this too is that the heat not only tightens the skin and melts fat, but it also cauterizes the blood vessels, so the bruising is not horrible. With a regular liposuction, you could be purple for 2 months. And if you bruise like that, it's like a huge black and blue. That hurts. Here, the bruising is minimal, and it usually lasts 4 to 7 days. No bruising, no pain. No pain, you're active. My patients go back walking the treadmill 2 days after the surgery. They can go to the gym and do everything about a week after the surgery, 8 days after the surgery. All right. Now we have the probe set in position, and now we're going to fire. Are we primed?
You're ready. You're ready.
Here we go.
And it's on the sheet.
And this is cauterizing the blood vessels inside while it's tightening the skin. How much pain are you in while I'm doing this?
Another thing.
Okay, we're going to do a little filler on our patient's face to turn back the clock by about 10 years. And the first thing we're going to do is inject a few points here that'll numb the portions of the face that we have to do the filler on. And a little ice pack too. Hold this here, I'll come on to that side. Alright, you feel a little pinprick. Relax. Open your mouth a second. Okay. It's coming down nice.
Mm-hmm.
Open.
Right there.
Right over the zygomatic arch. So this will be a nice numb shot for you because we're going to inject this right here.
Still on my board. No.
This is just a simple antibiotic cream. It has a trace in cream, but it's got such a good oil consistency to it that you can slide easily with it. And over here, this is going to be a lot smoother now.
Okay, I'll do that.
Just take a quick look without moving.
Oh my gosh! I can't believe that.
Yeah, that's with my bad shoulder. Because I have a... Get a little bit more.
Did I say?
You can get Queer Eye for the Straight Guy.
Oh, yeah.
And then this
I didn't
other
watch
thing
that,
about
though.
naked, ugly women that he makes dress nicely.
Oh, it's amazing how people become
You're
rich.
gorgeous. Don't worry about what people say. Yeah, you'll say anything for a buck.
Yeah, exactly. It's less gay now, though. Last couple times I was down there, I was like,
Yeah,
it's
no.
like families.
Yeah, it's a very family-oriented. His wife must have been disappointed he survived.
Wow, that's mean.
Aren't you in pain? Stop talking.
Don't make me laugh, because I would have kicked you instead.
That looks good. Nice.
He's been.
Oh, he's a baker? That's funny.
Well, if it was a cream cake, I'd be a little heavy. All right, hi. I'm going to add a little more volume to myself over here. I've been playing around with the plasma, and now I add calcium chloride to the mixture too to make it just a little bit thicker so that it stays in place longer. So you'll see me doing the injections in a few minutes to get rid of this like triangular depression that I have here and here. Okay? I'm just icing my face a tad now. I have 2 syringes of stuff, plasma, that I extracted from my blood. Okay. Now I'm iced. Here, just hold this for me. Massage this through. Take that ice back again. Now, if this doesn't pan out, my wife will kill me because we have a birthday party to go to in 5 days. Just twist this. Hold this. This one. That ice again. Now it's not going to stay puffy like this. You'll see tomorrow the difference. Alrighty. You know what?
I need to get all of this. Hold on.
Pretty good. Gotta get the other side too. Okay. Let's ice this first.
Chandika, you gotta make that face. She's looking like, ouch.
Alright, so this is immediately after the injections, and it really didn't hurt. It feels like a little bit of a sting, that's about it. Alright, so I put about 3 milliliters of plasma here and here, 3 milliliters each, and then tomorrow we'll take a picture, you can see how it looks, and we'll follow up on this. Bye-bye. Let me see what you're seeing on the screen. Okay. You filming?
Yeah.
You sure?
Yeah.
Okay.
Just,
here we go.
the
So
red
now
dot.
we're going to give him a couple of injections. Just tilt your head forward, Michael. What you're going to feel is the initial pinprick. How bad is that?
Not bad at all.
Told you. Instead of poking somebody 60 times, I just do it this way. The important thing is that, how much did you drink last night?
I feel. Why is it bleeding a lot?
No.
Not
No,
bad.
your head,
Anytime
your
you have
head
a little
always
alcohol,
bleeds.
it always makes it bleed
It's
just
not,
a
it's
little
not
bit.
bad
Your
at all.
head's gonna bleed regardless. It's just.
Now see, I add a little calcium chloride to this to thicken it. Keep an eye on the screen so that the stuff stays in place and interacts longer. Come on back. That's your friend.
Yeah.
If you want to see the shots, you have to come back now while we're doing it.
You can come back here.
Okay.
Because I'm doing it now. We're almost done.
You can come watch.
Okay. What am I watching? The hair?
Yeah.
Yep. Come on this side so you...
It doesn't hurt bad at all, Doc.
No.
Do you numb it?
Yeah. Well, you
Ice
numb
it.
it, ice it a little bit.
I don't put any lidocaine or anything in it because we don't want to dilute it. I want to keep it in a thick state so that it stays in the scalp, interacting with the hair follicles as long as possible. But if you go online and see their techniques, instead of doing this about 6 or 8 times, they're poking the scalp 60 times.